This is an important training video prepared by the Hypertension Awareness and Prevention Program at Yale. This video will outline several important suggestions regarding how happy volunteers should approach community members and conducting hypertension screenings.
As discussed in Barriers to Care on our website, many members of the low-income and homeless population have had negative experiences with the healthcare system in the past. As a result, they tend to be disenfranchised from the system and feel discouraged from seeking preventive health care. This in turn leads to crisis mode, episodic healthcare management through overuse of emergency rooms, while chronic illness such as hypertension remains untreated until end organ damages occur, threatening the lives of many affected people.
It is therefore a central mission for all happy volunteers to strive to help the community members to get back into the healthcare system. In order to accomplish this mission, however, we must be mindful of the challenges we may encounter.
For example, some community members may already have many serious financial, social, and personal problems. A physical illness may be the last thing they want to worry about. As a result, they are likely to be in self-denial and refuse to acknowledge that they have hypertension. Some community members may have had negative or even traumatic experiences of receiving medical care in the past. They may be distrustful or even fearful towards the healthcare system. For other community members, getting food and shelters or dealing with alcohol and drug abuse problems may represent a higher priority than receiving primary health care. As a result of these and other possible problems faced by the homeless community, it is often difficult to connect a community member with the system immediately.
Happy volunteers must be patient, flexible, and persistent in our pursuit to establish connection between the underserved community and the healthcare system. We should avoid appearing to be judgmental against community members. Avoid being overly pushy when attempting to connect community members to follow-up care who are resistant to treatment. Also, do not feel surprised if a community member appears to be negligent towards his or her elevated blood pressure. Do not feel personally offended if a community member appears distrustful towards your suggestions and help. Instead, we should always strive to understand and be sensitive to the financial, social, and personal problems the community members may experience. Listen to their previous struggles with accessing the healthcare system, try to think from the perspectives of the underserved community members, and continuously attempt to reconnect the community members with the local community health centers.
We should aspire to offer community members the resources and information to improve their health. We cannot force them to do anything and should respect their rights and choices. Community members will come to respect us in our roles as friendly, knowledgeable advocates. Most importantly, we must be committed to the cause by establishing a permanent and regular presence in the community. If at the first time, a hypertensive community member, who is not under the care of a primary care doctor, refuses to be connected to a follow-up medical appointment, by serving in the community on a regular basis, we can hope to eventually connect this person with the local health care centers through continual interactions.
It is thus suggested that all happy volunteers should extend courtesy and friendly attitude towards the community members, so that the community members may return for subsequent blood pressure screenings. Furthermore, if you are a responsible and courteous volunteer who is dedicated to the service throughout the year, you will be able to establish cherished, personal connections with many community members. They may in turn feel grateful for your dedication and service, and consequently, come to trust your suggestions.
While it is certainly important for all happy volunteers to be friendly and courteous to community members, sometimes your conversations with community members may lapse into street talk. We recommend that all happy volunteers remain professional in speech, dress, and demeanor at all times. Our professionalism will result in greater trust and respect from the community members.
In short, all happy volunteers should strive to obtain the trust of community members by being regular, dedicated, and resourceful. In this way, happy volunteers can help to create a long-term, community-based approach to promote self-management behaviors for hypertension among the low-income and homeless population.
Throughout blood pressure screening services, Happy volunteers must acknowledge that we are not health professionals. Although most of us strive to become, and in the future will become successful physicians and healers, we must realize that, as undergraduate students, we are not qualified or allowed to engage in medical diagnosis of any kind.
As happy volunteers, always openly acknowledge to community members, you are an undergraduate student. Under no circumstances should a volunteer provide diagnosis to a community member. When a community member's blood pressure is within the normal range, you should avoid using descriptions such as good or healthy. Instead, simply state the screening result that the person's blood pressure falls into the normal range at the time of the screening. Likewise, avoid using descriptions such as very bad in communication with community members to avoid undue emotional stress.
A happy volunteer should never speculate the cause of a community member's elevated blood pressure, nor should a volunteer ever give any suggestions or comments on a community member's prescription medicine use. Even if you feel you have some general understanding of certain medical matters, always refrain from going into discussion about medical matters with a community member. Instead, you should acknowledge that you are only an undergraduate student and any medical discussions should be directed to a physician and healthcare provider.
Always remember to stay within your role, that is, you are a volunteer to provide blood pressure screening for community members, and stating what the screening result is. For all community members, you may provide them with general suggestions about how to lower blood pressure by making changes in their diet, lifestyle, and doing physical exercises. If a community member's either systolic or diastolic blood pressure is in the borderline or hypertension range, you may suggest them closely monitor their blood pressure and see a health care provider to lower the blood pressure.
Actually, if a community member asks you about medical questions, which you are not qualified to address, take the occasion as an opportunity to suggest the community member see a physician to resolve the medical question.
Do not leave community members with the wrong impression that we are trained healthcare providers. Otherwise, a community member may take your unqualified suggestions as medical advice, and there may be serious, negative consequences. Therefore, there is no greater harm that happy volunteers can do by going beyond our capacity. Remember, good intentions without well-thought-out actions may lead to very harmful outcomes. We demonstrate our responsibility and professionalism as community volunteers by making sure that all of our pressure screening readings are accurate, and our communication about screening results is clear and accurate.
All happy volunteers must also realize the inherent limitations of hypertension screenings. Screening for hypertension for only once is ineffective, since a diagnosis of hypertension can only be made based on a series of measurements taken over a period of time. In fact, studies have shown that single reading screens result in 33% false negatives and up to 66% false positives. However, these limitations do not mean our hypertension screening services are ineffective.
On the contrary, our regular, weekly blood pressure screening programs are specifically designed to address these limitations. Because happy volunteers are stationed at multiple locations in the community on a nearly daily basis, we can avoid the inaccuracy associated with single hypertension screenings by repeating blood pressure screenings with the same community member over time. Therefore, it is extremely important that we encourage all community members to take a blood pressure reading with us as often as possible. It is also crucial for all happy volunteers to attend all designated screening volunteer shifts.
By establishing a consistent weekly presence in the community, we actually provide a means for the community members to develop self-management behaviors to manage their blood pressure levels regularly. Moreover, since we keep serving the community throughout the year, we can hope to attract more and more community members into receiving regular hypertension screenings, and over time, we can foster more prevalent self-management behaviors among the low-income and homeless population to manage their blood pressure.
Lastly and most importantly, by constantly interacting with the community members, over time, we strive to bring more and more of them back to the care of a primary doctor, preventing serious illness and mortality caused by chronic hypertension.
This concludes this training video. Thank you for watching and happy volunteering.